So we then move on to the second speaker of this session. I'm very privileged to introduce Professor Carmen Wong. Professor Carmen Wong is the Assistant Dean, Education, Faculty of Medicine, COHK. She is also the Associate Director, Office of Medical Education, COHK. He was awarded the 2020 UGC Teaching Award in recognition of her contribution and achievements in medical education, interdisciplinary and multi-sectoral educational collaborations. She's very experienced in educational research, include use of online learning and learner well-being and development. Her works include the development of electronic medical tools such as the COHK Medical Audio Glossary for health professionals, blending online and experiential learning in clinical communication skills, social responsibility, and interdisciplinary curriculum design and implementation. Please welcome Professor Wong.
Hello, good afternoon. I'm just going to share my slides. So it's great to join you this afternoon. And I just wanted to give you an overview of what's happening within undergraduate medical education. And I think that this actually gives you an overview of some of the faculty's considerations, I guess, for education. And also the response that we had going into COVID-19 when it first started. So, right. So adapting to online learning, what Colin had alluded to was actually we had to respond very quickly. And so when the COVID-19, the first case actually was diagnosed on the 22nd of January. Prior to that, you know, because of our close relations with China and also previous experience with SARS, there was already discussions within the faculty team of what we would do if, you know, the first case came into Hong Kong. So actually, when the first case was diagnosed, we were not surprised. And we already had some plans in place. So for example, there was a rapid response task force that was set up. And so it had like a few year coordinators, medical education office, associate deans of education, etc., clinical, preclinical. So we're already discussing what would happen if and when teaching would be disrupted. And so actually the faculty response, as soon as the first case came on, was that we would suspend clinical teaching and clinical attachments. And this was, I guess, prompted by a lot of the media that we were seeing of the cases in China, that other medical schools were probably, particularly in the West, weren't really as, they weren't looking at the risks. And because of CUHK's experience with SARS that actually affected a whole ward, medical students, etc., and Hong Kong, then we were very, we had a very rapid response that actually everybody was on board, and that actually made it a lot easier. And so as we went on, so that was the 22nd of January, and on the 25th of January, this was the CUHK response. So this was actually on campus. They decided to suspend all face-to-face teaching. So we had actually, you know, thought of that before the Chinese university really thought about the impact. This was also, as you remember, going into Chinese New Year at that point. And so during Chinese New Year was when all these discussions were in place. And so even in the first meetings that we had at the end of January, we were already thinking of online platforms that we could use. And there were quite a few online platforms at that point. There was Blackboard, there was Moodle, there's, you know, also like a faculty kind of platform that we had there as well. We had to think about what's the best one to reach. And it was Zoom that was identified much earlier and actually had been a savior in a way to get everybody trained on a similar platform. And so we already had thought about how we would train all the staff and students, and then thinking about, you know, rescheduling what are essential, non-essential sort of teaching, and what that new term would look like. Okay, so after Chinese New Year, we were all prepared for actually how are we going to go forward. We knew that this would probably be for at least the rest of the academic year, and we were planning for that. And so towards the so by March then but we took it I would say a week at a time, a month at a time, rather than, you know, we weren't thinking of exams in January, but as we were getting closer to the exams and COVID was still continuing and getting worse. I mean, in Hong Kong, we had actually a pretty good response. And so there was still a lot of fear in the community, a lot of fear within students and staff as well that we had to deal with, particularly sort of in March. And so even then, students were afraid to travel to come for their examinations. And so we had to weigh up, should we continue examinations? As Colin has said, some countries already had waived students without the examination. And in Hong Kong, with the medical council as well, we knew that we needed a standard setting. So for those that do pass the exam, we can vouch that actually they were as competent, as safe as students in the past. Okay, so that was our outlook for when we were looking at examinations. So the professional examinations, we were adamant would go ahead. And part of this was also setting the expectation for students as well. So as you can imagine, students would also have a difficult time in that sort of expectations. They've been hearing a lot in the media about other medical schools forgoing examinations, and they were, you know, hoping that that would be the case. But, you know, from a faculty point of view, we had to ensure that they were of a particular standard that we knew that they could achieve and could show their achievement and evidence that for their professional sort of training as well. So that was what our stance was. And so training workshops was in January, so Zoom. And Zoom is actually very user-friendly, and I know most of you would have used, is using Zoom now, but are very familiar with that. But actually the training of that was, it was quite systematic. We trained the teaching staff, administrators, very, very important, is the support staff that actually was teaching some of the teachers as well and giving some of the technical support. We had to train the students. We had an ongoing sort of technical support and guidance from the Office of Medical Education for those, you know, because all of our technical logical sort of skills are very different. Okay, so some people don't use computers very much, and some actually use it quite a lot, different applications, etc. So it's really providing the support for that guidance. And also from an educational point of view is then what are the best sort of things that you could do through Zoom? What are some of the interactive things that you could do? So things like using polls, right? Using other tools in which that you can use quizzes, etc. All of that is to enhance interactions, how to use breakout rooms, etc. All of that will actually help that kind of interaction that you get online that is quite difficult to simulate as the face-to-face. Okay, and so within the teaching support, we also had group sharing between our teachers to kind of say what works, what doesn't work, you know, how interactive are the students, what do they do to actually enhance their interactions, etc. And so conversion to online learning. And so you would, some of you from your own experience will know that for lectures and tutorials, they kind of transfer quite well online. I'm in family medicine, and our communication skills workshop actually worked really well online. We sent the surrogates scripts in advance, and then we did the whole thing online. There was a tutor, so it ran very much as you would do in an online sort of forum. Clinics, initially it was all the students were not allowed clinical practice, and so we had to think about, well, how do we do that? And Colin also mentioned, you know, cases. This is how students really get to understand things like patient presentations, because they're all very different from textbooks, where it seems to be quite bog standard. And so the interactive case studies were actually based on real cases that we actually seen in the clinic. So it gives them a feel of, well, what would be a real patient that they see? And I think that that's really lacking during COVID-19, really, is because they don't actually see real patients. Some of the professors were actually, they were very keen to role play that patient, okay, so they can have some idea of what it was like interacting with them. And also the added thing that is quite good with Zoom is that, but it takes a lot of preparation work, and actually a lot of teachers actually spent a lot more time doing that, is to have sort of pictures, pictures of patients, with the face obscured for privacy, having screenshots of clinical notes, results, investigation results, etc. So that kind of gave them more sort of insights, getting students to interpret the sort of X-rays results as they're going through the case. So that the students and teachers found very helpful, because actually within a real clinic, you probably don't have time to break down all of these different components, and you probably go quicker than you would do because the next patient is waiting for you. And so that is something that has been sort of gained during COVID-19. But as you imagine, it actually takes a lot of preparation. Then as the clinics resumed and tutors were much more comfortable with online learning, then they allowed online observation, even online clerking. So students stayed at home and they were able to clerk at the patient as well. Physical examination, demonstration, that's the best thing you could do. Either you demonstrate or you get the students to demonstrate. And obviously it would be the same if it's face-to-face. The best thing is small groups, but obviously small groups are actually very limited by the time that you can give them per tutor. And so that remains a problem on online teaching as well. Community visits were suspended at that point because, it was another expectation. So you have staff expectations, you have tutors expectations, you also have students expectations. And then you have to liaise with the community. So we have doctor and patient modules where actually the students go out to a family. So then you have to liaise with the family as well. And so that in the initial phase, it was actually pretty difficult. There was enough work to be getting on with. And so actually, if you're reviewing the curriculum or even your own teaching, I guess it's really focusing on what you think might be the sort of the essential learning outcomes and competencies. And within a curriculum, there will be some that are essential and some that are desirable, right? And actually what was really good about family medicine is we actually had this talk a couple of years ago when we were reviewing the curriculum. What are some of the essential parts, what are the desirable parts? So we actually grouped student competencies in that way. So then when it came to COVID, we just, the desirables were just desirables. Those are the ones we are not focusing on, but we knew we were already, the team already knew what the essential components were, and that's why we were able to deliver that. The team approach, very, very important, and we use the best available adaptations. As I say, some of them took a lot of time, and some of them, with regards to physical examination, was not possible. And so that's just some pictures of what we did for demonstration or outpatient. So this was right in the beginning when outpatient was much more orchestrated, and later on people as tutors felt more comfortable with it being in a more spontaneous environment, not as much tech support. They were able to do that themselves. Yeah, and so with real patients, etc. And so the other thing was about resuming clinical teaching in wards and outpatients in hospital. So we had to gradually phase in different sort of years. And again, focusing on the essentials. So the preterms first, and then Med 6, Med 5, Med 4. And then thinking about low risk areas, right? High risk areas. Designated sessions, etc. And the changes that were during COVID is that they had to be supervised practice. Now, from an educational point of view, I feel that this is actually beneficial for students. Often students, even before COVID times, were like, we don't know what we were doing. They got there, they're always shouted by the nurses, they should be standing here, there, everywhere. And so actually when they have more supervised teaching, they knew where they were going, that how long the sessions were, they were a lot more intensive. Actually, students really liked that. And obviously we had to strengthen the infection control. Colin talked about PPE, and Hong Kong, we're fortunate enough that there was adequate PPE for these clinical attachments. Students had to fill in a health declaration, and we're all familiar with health declarations now, but during at that point, we had to think of our own ways in which that we can vouch that the students were safe to be on the ward, as well as so for their safety and also for the patient safety as well. And so other things was we had to keep a tab of which students they saw for, which patients they saw for contact tracing. So that's something that you're very familiar with now. We were in midway of constructing a mobile app for things like attendances, timetables, clinical activities anyway. And so actually when COVID came on, it was actually quite easy to put all of those health declarations, etc., their clinical sessions on the app, and actually helped with the organization, and also their online timetable. So when they've got lectures and things, it was just one place where they had to see that. Often they just have multiple emails from different sort of courses, etc. So it actually made it a lot easier. And obviously with clinical and community attachments, when the community attachments was then allowed, it's then giving the students adequate sort of preparation have good infection control measures. And this is something sort of the public and also community expects from the students as well. So we had to make sure that the students knew this, and the Department of Microbiology was also involved in training students at the clinical level, and now at the preclinical level as well, because they know that actually students are going out and doing sort of visits as well. And so this is a very busy slide. This is just to show that actually we thought that, having the professional exams at the end of the professional exams, before the start new academic year, we thought things will just continue as they would be, limited clinical exposure, etc. And then there was subsequent waves of COVID. And so we had to think about, well, what would we do? Because in July, all clinical attachments were suspended after giving sort of the go-ahead. And then so we had to think about, again, continuing what we had been doing. And then that's when we started seeing that actually this is going to be the new normal, right? So that's something that we were preparing for. Other things very quickly, just so that you know the scale of the operation, is that online written examinations are not an easy task. So you have a look at, these are all the staff, and they are looking over sort of 20, 30 students. Students have to have lockdown browsers. There's a lot of tech support. They have to show that they are the person that they are doing the ID. We have to monitor their behavior during the written exams. And very interestingly, so the Wi-Fi connection, very important, even from a campus and also from the students' point of view. Students could come in with social distancing if they had Wi-Fi issues at home. But one of the interesting things was that it was the students that actually brought up about fairness issues. So not only was it anxiety provoking because, this is a new form of examination, they're also worried about Wi-Fi connectivity. But obviously, where there's a way, there's usually, ways of perhaps cheating or cheating the system, or so although we do this where we've got two cameras and it's looking at the desk, it was the students themselves that raised about fairness sort of concerns. Right, so there has been, not in the medical faculty, but there has been across the university incidences where there has been cheating involved. And this was something that the students said that they felt that there was fairness concerns, particularly if there was one or a group of students that was doing that. Fortunately for the faculty, we haven't had any of those incidences, but there's lots of investigations that's sort of done by the university for that. And so the mock examination. Thank you. And so there's a mock examination beforehand, just to make sure everybody can come along. They've not got any of those issues, and that they're familiar with what they have to do. So that, again, takes a whole day. So examinations face-to-face, so advanced communication with students with their expectations, making sure that all the students know what is required of them about the health checks, the infectious control, you know, what to do on the day, etc. Social distancing on the day, okay, that there's adequate staff, that, you know, that people are in subgroups and they're not all together. And now we have about 300 students. So you imagine, you know, for the professional exams, this is some of the things that we have to do for that. And so external examiners, you can bring them in, and listening to other external examiners. Not many medical schools do this, but we have continued with this. And one of the things to be aware of, obviously, is time zones, because we have different external examiners from different countries. And we've had to, you know, schedule some of these in the evening, etc., to adjust. And sharing is really important. You know, when we first started this, we were one of the first ones in year 5 to have examinations, and then obviously all the others then learned from our experience, and then the experience kind of built on. So actually sharing within the team is really important. And so the new normal. So we will, you know, from here onwards, be continuing with some sort of hybrid form. And as Colin has alluded to, actually online teaching has a lot of strengths. And so we will be using some of those, particularly for asynchronous teaching. And the fortunate things for a lot of the courses I've done before, they've always been kind of like blended learning. So they were asynchronous sort of modules that you do online, and it has been a blessing during COVID because they just ran, you know, and so you still can keep that, they can do that at home. And then there was a different sort of teaching activities, prioritizing professional exams is really important, and then our contingency planning is with regards to sort of community, hospital and university level. We have to make sure we have all of those levels built in, and investing in staff training and technical support is very important. Thank you.
Thank you very much, Carmen. So I can see the very great effort you put in turning everything from real to online, including the lectures, tutorial, even clinics, and some of the exams. So there's much effort needed. Thank you.